Hello and welcome to Conversations with Carrie. Today we'll be speaking about private home care, and I have with me Lynn from one of the premier providers of private home care in Palm Beach County, ExpiCare Nursing Agency. Lynn, thank you for joining us.
Thank you for having me here today, Carrie. I really appreciate it.
My pleasure.
Wouldn't it be nice if you could have a caregiver come into your home, help you get out of bed, help you shower, get you dressed, make you breakfast, and then give you a 30-minute foot massage?
That sounds like heaven, Lynn. Is that even possible?
It is possible.
Ah,
At ExpiCare, we're not just companions and caregivers, we're actually medical professionals that will come into your home, set up a plan that meets your needs and your family's needs to care for you on a regular basis.
okay, and give foot massages and.
Foot massages will help you with your groceries, we'll take you on errands. Our girls and guys, we have both, they will stay busy. They'll work with things. We've been known to bake cookies, make you a nice home cooked meal, even to organize closets if you need your closets organized.
And then on the other hand, you have higher levels of nursing care demands that you also take care of.
We do. We have not only certified nursing assistants and home health aides, but we also have licensed practical nurses, LPNs, and registered nurses that can come into your home and provide services, the same services that Medicare would provide that maybe your insurance doesn't cover, or someone from Europe or Canada that doesn't have insurance in the United States might need care in the home. Those types of things we can provide as well.
Okay, that's great. So, so you provide a wide range of services to private paying clients.
In
Okay.
their home. As
Okay.
well as that, Carrie, we also provide staff to area hospitals, nursing homes, community care centers, anyone who would hire a nurse, a
Mhm.
LPN or an RN that might need some additional staff, we do staffing as well.
Okay, so you provide support for other nursing organizations or healthcare delivery organizations as well as private care. So does that mean you accept no forms of insurance?
We will take private pay,
Uh-huh.
but we also take what's called long-term care insurance.
Okay.
A lot of individuals will purchase long-term care policies to help assist them with aids to daily living as they get older. And in order to use that insurance, we can verify your benefits, tell you what you would qualify for.
Mhm.
We would have you sign a HIPAA form, send it into your insurance agency, and then we have an insurance person that will actually contact you and explain your benefits that are available to you through your long-term care insurance policy.
Oh, that's great because I know a lot of older patients who have either forgotten what their insurance coverage or benefits are, and so this actually does help. Now, do you need a physician's order to use the long-term care insurance?
Not for private home care. You may need physicians to fill out forms for your long-term care insurance.
Okay.
But we can help you with that as well. Either I'll come into your home and help you, assist you with the forms. We can also fax them to the doctor a lot of times, and then we'll help you coordinate everything so that your policy will pay for your care.
Okay. So private pay and long-term care insurance are your methods of payment.
Correct.
Okay, so if I decide that I or somebody that I know has a need for care at home, we don't have to be sure as long as we have the long-term policy. You can always help us to verify if your
Absolutely.
services.
And again, some policies are different. Some
Okay.
you have to have like 2 or 3 aids to daily living. You cannot feed yourself, you can't shower yourself, you can't get out of bed. There's certain qualifications, but
Okay.
we would help you understand what your policy would cover
Mm-hmm.
and what aids to daily living you need assistance with. And we certainly wouldn't charge you anything until we found out all of this information so that you understood what would be covered and what might not be covered.
Okay, so how does the public and the physicians and the relatives of persons that may need home care get a hold of you?
They call us at our office 24 hours a day, 7 days a week. We're at 561-736-1422. Again, that's 561-736-1422. You won't talk to an answering machine or an answering service. You will talk to one of our coordinators that are available Monday through Friday until 9:30 in our office, and then on the weekends, 8 a.m. to 6 p.m. in our office, setting up care. And after those hours, we have coordinators setting up care in remote locations.
Okay. All right. So thank you so much, Lynn, for joining us. This has really been an eye opener. So once again, if you do not have insurance, it doesn't mean that you can't get care. We have private care providers that will take care of you in your homes. And if you have long-term care insurance, they can always help you to figure out if their services are covered under your insurance. And Lynn, thank you so much for joining us.
Thank you.
And join us next time here for Conversations with Carrie. If you have any questions about private home care, you can always submit your questions via our Facebook page or call Lynn. Once again, Lynn, if you could give their number.
561-736-1422, and I'd be happy to come to your home to help you set up private care.
All right, until next time, thanks for being with us on Conversations with Carrie.